Alex. Thank you for doing this. Thank you for inviting me back. Yeah, I mean, I'd love to get into a discussion about what you all want to talk about, but I figured I'd maybe hit three topics up front. One not so good news, the Supreme Court fight. Another potentially good news, which is the path forward on mental health legislation, and then talk a little bit about the work that I've been doing this week in Washington on the heroin crisis, which is just epidemic proportions. And then happy to cover any other topic. So I just came from UConn Law School, where I gave a talk about the potential long-term consequences of the Supreme Court nomination continuing to go without hearing or without a vote. And I think this is a pretty pivotal moment in the history of the Senate. Everything had been becoming a political football, but over time the Supreme Court had been treated differently. There had been a history of the Senate taking very seriously the nominations that the president makes to the Supreme Court, and at least showing the president the respect to move a process forward, even if in the end that process didn't result in a vote being taken. And I take Mitch McConnell at his word. I don't think that he's going to support a process of hearings or a vote on the Senate floor, and I think that has potentially catastrophic consequences for the federal government. I think the first is that the Supreme Court just becomes another political football, and you may enter an era in which if the president is of a different party than the United States Senate, he may not ever get a vote on a justice. And if that's the consequence of this, then you are also entering into an era in which there may be, at any one given time, only 6 or 7 or 8 justices on the Supreme Court, if there's a prolonged period of time in which the president and the Senate are of a different party. I also worry about the sign of disrespect that's being showed to the president by not even holding a hearing or refusing to meet with this nominee. There's no question that Merrick Garland is qualified. And in normal circumstances, the vote would have been expedited, it would have been bipartisan, this would have been over and done with relatively quickly. But there is a pretty insidious undercurrent of the electorate in this country that doesn't view this president as legitimate. And it sometimes seeps into the way that Congress talks about him. There's been a double standard when it comes to this president's ability to exercise his diplomatic powers overseas. There's been a double standard when it comes to his executive orders. He's issued far fewer executive orders than any other modern president, and yet this is the imperial president. This is the despotic president. And so I think this failure to even show enough respect for President Obama as to meet with his nominee is dangerous to the future of political debate. It's not just dangerous to the future of the Supreme Court. You're starting to see cracks. Republicans are starting to at least give meetings to Garland, and some of them privately are suggesting they might vote for him. So maybe this debate moves, but unfortunately I think right now Republicans are intent on denying him this process, and again I think the consequences are pretty serious. That's the bad news. The good news is that there were a lot of people that were suggesting that Democrats in retaliation were going to shut down the floor of the Senate. I and others have counseled against that. I don't think we want to engage in tit for tat, and I also think there are some really important legislative initiatives that we can pass in the remaining months, and we shouldn't let the fight of the Supreme Court shut down the Senate. The most likely of those major initiatives is my mental health bill, and I've talked to some of you about this in the past, but for the last 2 years I've been writing a major bipartisan overhaul of the nation's mental health laws. We now have 16 co-sponsors, 8 Republicans, 8 Democrats. It passed unanimously out of the Health Committee 2 weeks ago. Mitch McConnell, from what we understand, is committed to bringing it to a debate on the floor sometime this spring. And this bill will make a big difference. It's really framed around 3 ideas. The first is Major new resources for both inpatient and outpatient. So there's new funding sources in the bill for inpatient beds, which we've lost 4,000 of since the recession, and outpatient capacity. We know here in Connecticut the waiting times are often weeks and months for individuals in crisis to see an outpatient clinician. Second, the bill provides incentives for states to bring together their mental health delivery system and their physical health delivery system. In the 1960s, we built a community mental health system, and that was really progressive at the time because it allowed us to deinstitutionalize the mentally ill, but it created these artificial barriers between how the medical system treats your head and how the medical system treats the rest of your body. Our bill would start to bring those two systems together. And then third, the bill includes the what you'd call the son of mental health parity. Mental health parity was the idea that your insurance should cover mental illness just like it treats physical illness. And it is true today because of a federal law passed about 10 years ago that your statement of benefits will tell you that you get the same amount of behavioral health treatment coverage as you get a physical health treatment. But what the insurance companies have done is erect all sorts of procedural barriers, bureaucratic barriers to accessing that part of your benefit. And so our bill would require the insurance companies to have equal access, not just equal coverage to behavioral health care. It is likely that the bill is also going to include, when it gets to the floor of the Senate, some major provisions related to the opioid crisis. Earlier this week, I spent a day traveling the state, viewing the opioid crisis from a variety of different perspectives. I was here in New Haven at the Connection, but I was also with law enforcement in Groton at L&M's emergency room, sitting with individuals in recovery in Bristol and with the firefighters who dispense Narcan in Waterbury. This is an epidemic, and there is an unfortunate double standard when it comes to how the federal government is treating this epidemic. We had less than a half dozen Ebola cases in 2014 in this country, and the federal government Congress passed a $4 billion emergency appropriation. And with that funding, we did incredible things. We stopped Ebola in its tracks. We both protected the United States and used that money to beat the epidemic in West Africa, saving potentially 1 million lives or more in West Africa. Congress is refusing to allocate any emergency dollars to the opioid epidemic, despite the fact that over the last year, 700 people have died from drug overdoses in our little state alone. Compare that to 4 people that died from Ebola in 2014. The common thread that I heard earlier this week was the lack of resources. The emergency rooms don't have the resources to treat the overdoses. The cops don't have the resources to go after the dealers. The Connection has a 6-week waiting list where they can't see people. We need some more resources. And so when our bill comes to the floor, we're hopeful that we're going to be able to attach to it some new resources for the opioid epidemic, and I can talk to you more about that in general. Very lastly, and I'll just add this on, I've spent a lot of time over the last year or so sitting with the startup community and the entrepreneurial community here in New Haven. In fact, I think we have another roundtable coming up with the startup community here in New Haven. Spent a lot of time with Yale talking about their startup efforts. Obviously, we're very excited at Alexian Pharmaceutical grand opening. I'm continuing to push a startup agenda in Washington. I'm the primary sponsor of legislation that would incentivize more angel investors to provide startup capital to small businesses. That's just one of a number of pieces that I'm working on to try to build federal support for a startup agenda. I think that's New Haven's future. I think New Haven's future is to become an East Coast Silicon Valley to mirror what Boston has successfully done over the last 10 years. There's no reason that you can't have a vibrant startup community in and around New Haven. Alexian can be a drawing card for that downtown, but you need some changes in federal policy, specifically around the question of access to capital, that will help. So I continue to be very excited about that part of New Haven's economic future, and I'm going to try to lead that conversation in Washington. So anyway, with that, I'll open it up to you guys.
Can I start? Something that I'd like to hear more from you about is based on the trip that you made on the submarine, and Mary did a story about that and some of the things you said on that call. Can you tell us, and I really think people need to know more about this, can you tell us, in your mind, what kind of national security risks that the United States has to look at and that people should be aware of amidst climate change?
Right. Well, you know, to start with, I think you probably all read the new report that suggests we have vastly underestimated the threat from Antarctic ice melt. And so, you know, there's a new catastrophic estimate out this week that suggests in our children's lifetime, cities along the U.S. eastern seaboard will be wiped out. I mean, that is stunning, but at some level not surprising given the fact that in my short time in Congress, the worst case estimates about global temperature change and sea level rise are now the mainstream estimates. You know, when I got to Congress in 2007, the worst case estimates were 6 to 8 degree temperature change by the end of the century. Those are now mainstream estimates, and the new survey of the Antarctic suggests that the western shelf could essentially melt and cleave off within the next 50 years, which would lead to, you know, the global sea level rise in the neighborhood of 3 to 5 feet, which, you know, would end the Connecticut shoreline as we know it. So that paper is a good read because it also tells us that it's not too late. And so this academic paper coming out of Penn State research outfit and a handful of others also suggests that we can do something about it. In the Arctic, you know, the ice melt has been faster than anyone estimated, and that is contributing to sea level rise, but it's also contributing to new opportunities and new liabilities in the Arctic. So in our lifetime, the Arctic is going to be navigable for commercial shipping. And the race is on as to who's going to control the flow of commercial sea travel through the Arctic. The Russians are making a major play for control of these developing pathways of navigation. The reason that the United States is up there, or has been up there with new research capabilities, is so that we can guard against the Russians controlling or shutting down shipping channels. You know, I've always told people that this sounds totally counterintuitive, but part of the reason that we have a subbase in Groton is that you can get a submarine to the coast of China faster from Groton than you can from San Diego. And the reason for that is that you can go under the Arctic. If all of a sudden you can traverse the Arctic with a surface ship, you will completely change commercial shipping patterns. And so part of the reason that the U.S. has a major presence there is because of that inevitability. But you know, none of the benefit of those changed sea travel routes will mitigate the catastrophe of the water flowing out of the Arctic into the Atlantic combined with the melt of Antarctica. We do not have the resources to build walls across the entirety of the eastern seaboard. You could probably save New York. You'd probably come up with the money to save New York and save Miami and, you know, New Haven, but you couldn't save every town and every settlement that's along the Atlantic if the ice melts from the Arctic and the Antarctic as fast as this new paper posits. And so it's another clarion call for us to get serious about climate change right now. It is not too late, but Paris isn't enough. the announcements at Paris are not enough to to prevent this massive melt of the polar ice caps.
Do you think people are taking, I mean, do you think that anybody might take climate change more seriously if they look at it in terms of, security? Because I know you talked in that call after the subride about your concerns about Putin, and, it doesn't seem to me that Americans are paying that much attention to him.
Well, well, you've got to care about Putin from a variety of perspectives, but they're making a major play for the Arctic because they see the opportunities there. But no, we have to do a better job of talking about global warming from a security standpoint, and we've already seen the results of global warming. So, if you tell the real story of Syria, it starts with a massive multi-year drought that meteorologists tell you is the consequence of global warming. If you want to tell the story of instability in Mali, it starts with a massive multi-year drought that meteorologists tell you is the consequence of global warming. And so the instability that we're seeing in the Middle East and in Africa is today the result of climate change. And so we've got future security challenges from climate change, but we have present security challenges that are posed by climate change. And we don't often talk about the nature of the civil war in Syria through that prism, but we should, because if you really look at what created the destabilizing moment in Syria, it was the massive migration of farmers into the cities because their crops had dried up. And so you had this massive demographic shift into the cities of people who had no marketable labor skills because they had come off of farms. And that instability is in large part what drove the initial opposition to Assad, which launched the civil war.
Thank you.
Sorry, you mentioned barriers that insurance companies have put up to mental health coverage. Could you give an example of what kinds of barriers those are?
So here's a perfect example. If you walk into the emergency room, and I can't speak for Yale, but I know this is the case at many Connecticut hospitals. If you walk into many emergency rooms in Connecticut with a broken leg at midnight, you will get immediate treatment. They'll call the orthopedist on call, they'll come to the emergency room, and they'll begin treatment on your broken leg. If you show up at an emergency room at midnight having had a psychotic break, you will not see a mental health professional until 9 or 10 the next morning. And the reason for that is insurance companies require prior authorization, meaning a phone call to the insurance, what prior authorization is, it require prior authorization before anyone in an ER sees a behavioral health clinician, but they don't require prior authorization before someone sees a physical health professional. So what happens is that mental health patients get warehoused overnight routinely, just festering and stewing in their crisis, and they don't even get evaluated until the next morning. And so the hospital could pay for the person to see them overnight, but they say, why would I, pay to have somebody here at midnight if I can't actually refer them anywhere until I can get an insurance company on the phone the next morning? So that's a perfect example of where there's disparate treatment between the two. And same thing for outpatient treatment. If you want outpatient treatment, you likely have to go through a whole prior authorization, whereas if you want physical therapy, for a certain number of visits, you won't need prior authorization. You get that as a matter of right. The denial rates are much higher for mental health treatment as well, if you look at them apples to apples. So there are all sorts of ways in which insurance companies just make it a lot harder for you to see mental health professionals. But that emergency room visit is always the one that strikes me the most, because when you have that first psychotic break and you're 22 years old, it's a cataclysmic event, and hours matter. The trauma that's building up every hour that you don't see somebody even to talk to them about it. I mean, imagine having this moment where you literally lose control of your mind, and then you have to sit in an emergency room until 10 the next morning without anyone having any conversation with you about what just happened to you. I mean, that is cruel and unusual punishment. And it's akin to having someone walk in with a heart attack and telling them, I'm sorry, we're just not gonna get you to see anybody until tomorrow morning. I mean, there's a reason why people with mental illness die 20 years earlier than people without mental illness diagnoses. It's because these diseases kill, just like physical diagnoses do.
We've gotten complaints about this is another way where the hospitals don't pay money. I mean, this happens with senior citizens a lot. Show up at maybe an emergency room and they're not actually given a bed, and then a diagnostic, I guess, on the insurance form is under observation.
Right.
And I had somebody call me who was in a bed for 6 days. Either never got corrected, or no matter who they argued with at the hospital, how far up they went the ladder, they never got corrected, and he was paying out of pocket for those days. I mean, is that something that's come up to?
Well, listen, the hospitals should have mental health clinicians on call. The excuse for why they don't is that they don't know whether they're going to get reimbursed until they get the insurance company on the phone. So they know that when the orthopedist comes in and performs the surgery at midnight that they're going to get paid, because that's automatic. They don't know whether the mental health clinician is going to get paid, and so that's their excuse, but there's nothing stopping them from having mental health clinicians available in the ED overnight. They just don't have them because they're not sure that they're going to get paid, and B, if they were going to make a referral, let's say somebody needed to be put into an inpatient psych unit, they can't. The insurance companies won't authorize that until you call them. So whereas again, if you had to be put inpatient, following a cardiac arrest, the insurance company doesn't require you to get prior authorization for that inpatient stay.
Right. This might be something different.
This
is observation.
The observation thing is a different. Yeah.
As opposed to admission, and this was a physical ailment.
I don't think I think those are two different issues.
But people end up paying out of pocket as opposed to being covered under their insurance, so it's a big deal for this.
Yeah, and
a 90-year-old.
Yeah, and we've been pushing legislation on that as well.
Well, I mean, just one more medical question. Would you mention the money for the opioid treatment? So that may come up with your mental health bill?
So, we have been, a number of us have been pushing for an emergency appropriation to confront the opioid crisis. We've suggested $600 million, which, quite frankly, is a drop in the bucket compared to how much money we spent on Ebola. And when you spread it across 50 states, is going to be, of important but limited utility. We tried to pass that in the Senate 2 weeks ago, and the Republicans voted against it, so it failed. I imagine that we would try to attach that as an amendment to my bill again. But there are other non-monetary ways to increase access to treatment. One of them is a change in the prescription laws. So the most effective anti-heroin drug is something called Suboxone. But there's a federal law that says that a doctor can't prescribe Suboxone to more than 100 patients, and it doesn't allow for other medical professionals like APRNs or physician assistants to prescribe Suboxone at all. The reason is of fear of diversion, that Suboxone does have a street value attached to it, and so there are worries that you won't be able to track. There's not an enormous amount of data that there's large-scale diversion of Suboxone, so the fear seems to be a little bit misplaced to the reality. And second, we desperately need to get more people into Suboxone treatment now, and we can't because of these caps. So it is very likely that attached to our bill will be a provision that would raise the cap and allow for PAs and APRNs to be able to prescribe Suboxone, and that would have an immediate positive effect in Connecticut. Suboxone is a life changer, but there are thousands of heroin addicts who cannot find anyone who prescribes Suboxone in this state, and not just because there aren't enough people that do it, but also because the federal website that tells you who prescribes Suboxone is horribly out of date, and we're trying to fix that problem as well.
Why do you think the federal response has not been more urgent on this?
The stigma. So, I think there is still an enormous stigma around addiction, and there are lots of people who don't think it's their problem, and think that addiction is a result of personal weakness, not disease. Listen, I have enough people close to me that have been wrapped up in addiction to know that there is always, an element of personal will and decision-making attached to an addiction story, but there is also a much bigger piece, which is a medical illness that needs medical treatment. So I think it's that stigma that people say, well, I don't need to worry about this because it's never going to happen to me or my family. And I think increasingly what people are learning in the heroin crisis is it can touch anybody. I did this roundtable up in Bristol, and 3 of the people there had gotten hooked on heroin through painkillers, and they had no history of addiction in their life, but they got injured. They got injured and they were prescribed painkillers, and they got addicted to the painkillers. It had nothing to do with a personal decision that they had made. They got physically addicted to the painkiller to the point that they couldn't stop taking it. And once their doctor stopped prescribing it, they needed to continue to feed that addiction, and they did it by going out on the street and buying heroin. And the way they talked about it, the one guy just said, if you had met me 3 years ago, I would have been the last person on earth you would have ever thought would be on heroin. But I injured my back, and all of a sudden, I'm out in the street buying heroin, and it was that simple a story for him. So I think it's that continued stigma.
With this opioid epidemic, as you described it, do you think there's some difficulty or challenges in actually getting these people who are addicted to these drugs to seek treatment? Or there's some people out there that either may not think they have a problem, or may not know where to go, or may just not want to seek treatment, so they stay addicted to these drugs. Is there any fear that if there's some federal bill passed that allows people more access, that people may just not necessarily seek it?
Well, put it this way, there's no open slots today in treatment programs in Connecticut. So there is zero evidence that there is an abundance of supply and a paucity of demand. So all of the evidence is to the contrary, that people are desperate for help and they can't find it. There are waiting lists a mile long for treatment beds. The emergency rooms are overflowing. Like I said, there are people desperate to get on Suboxone, but can't find any providers that dispense it. So, the data doesn't tell that story. Now, listen, as I said, of course, as with any addiction, there are going to be people who are, who are going to stay so wrapped in their addiction that they can't find a way to get help. But the evidence in Connecticut tells us that the problem is not a lack of people who want help. The problem is a lack of help.
Have you heard anything in the medical community about the prescribing of painkillers? Because we've delved into this issue numerous times in this newsroom. We've written a lot about it. We've written extensively about it, and the constant little refrain that we hear is most of these people are getting addicted through a painkiller issue, and it seems like that there should be more from the medical community saying, and I know doctors like to treat things the way they want to treat them, but are you hearing anything about that.
The medical community has not taken ownership over this issue like they should. I mean, you all here continue to hear the anecdotes of people being prescribed 30-day or 60-day supplies of painkillers just in case. You know, the detective, the top narcotics detective in Hartford told us the other day that in Hartford, 90% of his heroin addicts started with prescription drugs, 90%. And so this is a clear storyline from the drug companies through the prescribers to addiction. Now, HHS just came out with new prescribing standards for painkillers, and there's significant deviation from the prior guidelines. These standards, in fact, direct physicians away from prescription painkillers with certain exceptions. Palliative care, end-of-life care, and cancer being the primary exceptions. And so for the first time, the federal government is telling physicians that they should find alternatives to prescription painkillers for most patients that present with pain in their office. And that if they do give a prescription, that it should be, you know, of days duration, not weeks duration. So I think this is the turning point for the medical profession. I think if we continue to see the prescribing numbers in the past after these new guidelines, we're going to have to come out with some with a system that's not just carrots but sticks for providers.
It's my understanding, isn't there a new computer system that's being implemented so that we do away with the prescription pad that the doctors have, and everything has to be done by computer now, so that I can go to Mark on Monday and get a prescription for drugs, and then go to Mary on Wednesday, because everything is going to be entered into a computer now, and there's not going to be any need for the prescription pad. Isn't that just a new law here? Where did I read this? I just read this in the last.
Well, we're
days.
developing that database, but I was just, as part of my tour earlier this week, we were hearing about the gaps that already exist in this database. So now I'm not the expert on it as a state database, but from at L&M Hospital, the ED docs there were telling us that if you pay cash, you're not in the database. So the database is triggered by a reimbursement. So if you pay cash, you don't get hooked into the database. That there's certain things like methadone. If you're prescribed methadone isn't part of the database, so you're not in the database if you're doing methadone. I mean, listen, the real failure here is that we have no consistent electronic medical record system in this country. I mean, much of this problem would be solved if we all walked around with a card with our entire medical history, and that every time that you intersected with the medical system, it was documented on that card. And so we're trying to build a database now, but it's not connected to the individual. It's the responsibility is of all the providers to enter in information into that database. But you know, this should be another moment to cause us to go back to the drawing board on the way in which we do medical records, because if we all walked around with that card, it'd be really hard to go get prescription after prescription after prescription if every time that information was loaded onto that card.
Well, you said you've asked for 600 million, and you say that's a drop in the bucket. So how much would it cost to correct this problem, and how do we prevent from getting into another situation where we have methadone clinics popping up everywhere and spending hundreds of millions of dollars, you know, keeping those up and running? I mean, because it's kind of like stopping one thing just to, you know, keep it going somewhere else.
Well, that's why you have to focus on the upfront pathways. So I mean, that's why you've got to focus on the prescribers in the drug industry, and that's why the database is important. It's why these new guidelines are important. It's why ultimately we may have to pass new laws that crack down on physicians who are prescribing outside of the median. Because you're right, we're never going to have enough money to chase this problem if people still continue to get hooked over and over again on prescription painkillers. I don't know what the overall number is, but it's probably 4 times the amount that we're, that we're talking about. Remember, again, like just take Ebola. We need $4 billion to stop Ebola, and we didn't have a half dozen cases. I think if you really were honest about how much money you need to take on this crisis, it'd look much more like the number we allocated for Ebola.
Do we spend all that money? I mean, was it a lot of it for, going right to the source to it?
Yeah, so we haven't, and that's one of the fights, is that Republicans want to take the unused Ebola money and use it for Zika. So they don't even want to use it for the opioid crisis, they want to use it for Zika. But we have obligated most of the rest of that money, because what we're trying to do is correct for the flaws in West Africa that led to Ebola, which were public health systems that had no ability to detect or treat the illness until Western doctors got there. So we're trying to use the remainder of that money to try to build up some basic public health infrastructure in West Africa, so that when Ebola comes back, it's not if, when Ebola comes back next year or the year after, it doesn't get to the crisis point that it did in 2014. So I'm leading the effort to pass the emergency appropriation for Zika, but that's the issue right now. And Zika, by the way, is going to be here too. So, Zika, it's estimated right now that, it's not unreasonable to estimate that over 60% of Puerto Rico will be infected with Zika. And there's obviously a clear pipeline between Puerto Rico and Connecticut, so you'll see Zika infection rates jump here in Connecticut, and every day that we wait to appropriate dollars to fight Zika, and much of that was going to be spent in Puerto Rico, is a day that we put Connecticut at risk.
Aren't they talking now about it being much easier to pass from person to person than they thought before?
Yeah, we obviously certainly know the mosquito transmission, but we now believe that it's also transferred through bodily fluids. And while we know, we're fairly confident that if a female is, if you were bitten by a mosquito, it'll run through your body in a couple of weeks. It's terribly unclear how long it stays in semen. So a male could be infected for a much longer period of time. So we're learning in real time about Zika.
Speaking of Zika, do we know if those, I know they talk about it affects babies, smaller heads and so on. So is that a permanent thing, or does that eventually, it's a permanent thing?
It's permanent, yeah. Microcephaly is a permanent deformation. And that evidence is all but in. We don't completely understand the pathway, but we now can definitively say that there's a straight line from Zika virus to microcephaly.
When you were talking about the Zika, redeploying the money towards Zika, were you talking about mosquito control? Were you talking about what would you?
It's public awareness. It's mosquito control. It's research. I mean, right now we there's more that we don't know than we do know about Zika transmission, and then most importantly, it's vaccines. So there's 3 companies in Connecticut right now that are developing vaccines, and we could have a vaccine up and ready for Zika, but we don't have the money to develop it or to manufacture it. So that's what it'll be used for.
Okay, you were talking about startup businesses. And we have a lot of people come in here and talk about startup businesses and helping businesses get off the ground and so forth. But we're always mentioning businesses that are established, have employees, and are relatively big. Are there any plans to help, say, low-income people, whether they're minorities or not, get a running start and get their businesses up off the ground? I just don't see a lot of that. I hear a lot about big businesses getting breaks and this and that, but I don't see anything for the little guy to help the little guy, just, start out and, make a success. Is there anything going on with that?
Well, so that's, I'll attack it from two perspectives. One, that's my entire push on angel investors, right? So, angel investors sounds like a Silicon Valley loaded term, but all an angel investor means is, an individual who, isn't part of a bigger investment firm making a bet on a small business. An angel investor can be, your uncle, or it can be your next door neighbor. My legislation would give that angel investor a personal tax credit for the investment that they make in a small business. That's not just about the formal startup community. That's the story of how most small businesses are launched. It was a friend who made an investment in your company, and my tax credit would now make it more likely that your friend would want to make an investment in your business. Second, we've talked a really good game about minority small business development in this state and in this country, but we have not really walked the walk,
that's
right?
kind of what I
Right?
was gonna
We
say.
haven't walked the walk. So I held a big forum about 2 or 3 weeks ago in Hartford on reforming the minority small business contracting laws. And as a result of that forum, I've released a 4 or 5 point plan on how you can reform minority contracting laws to advantage minority small businesses. And it runs the gamut from staffing up more of the technical assistance agencies that help small businesses just establish their companies, to cracking down on contractors who are supposed to hire minority businesses but don't, and instead they just pay the fine because it's cheaper, or they say they looked for minority contractors but they couldn't really find them, to reforming bonding requirements, which often keep minority contractors out of construction projects because they can't come up with the bond necessary to cover the work. So I can forward that all to you, but we've come up with I've decided to really take a leadership role on this question of minority small business contracting from the federal government and assistance for minority businesses, because what we've been doing so far hasn't worked.
We're trying that at the state level
So
too.
you get
Yeah,
Yeah, so
bonding.
the bonding thing, yeah, so Malloy's been really progressive on the bonding, so he set up this outfit in DCD that would essentially issue the bonds rather than the private sector. I also think it makes sense at the federal level to just dramatically increase the size of the job that requires a bond. Right now it's $100,000, but on a construction job you spend $100,000 in about 3 days. So I think that number's got to be $500,000 or $1 million.
Connecticut's in a lot of trouble in terms of its finances. If Chris Murphy had everything in his hand and all he had to do was sign and say, this is what we're gonna do, what would you cut and how would you get us back on track?
I mean, I don't have it's not unfair for me to punt on that. So I got enough trouble trying to manage the federal budget. I don't have my hands into the weeds of the state budget enough to make those recommendations. And the state legislature's got some really tough challenges ahead, and I know that they've been working on finding a more stable revenue source, but that seems to be one of the biggest problems, is revenue that moves up and down. Listen, I'll only give you one suggestion. Connecticut's got to get serious about regionalization. We have the most inefficient system of local governance in the nation. I live in Cheshire, Connecticut, and people live in Cheshire, Connecticut for a reason. But we can't afford the system that we have today. We can't afford it because of the level of duplication that we have, the amount of effort that's wasted when towns try to steal businesses from other towns. And kids in New Haven and Waterbury and Hartford can't afford it. I mean, we've isolated and segregated poverty by the virtue of the way that we draw our town lines that is no longer morally defensible. And so, this is a moment for the state legislature to invest in regionalization because it saves money, but, it's also a moment possibly to look at the moral foundations of our state, which are crumbling every day, that we force a handful of tiny, small cities in the state to manage almost the entire burden of poverty for the rest of us. That's unconscionable.
And we hear that a lot. I think probably you guys can back me up here, probably 5 or 6 times in the last 5 or 6 ed boards about regionalization. But I don't think we've heard anybody say, here's a way to do it.
Here's the way to do it.
Even yesterday, somebody from a education advocacy group said the same thing.
Talking about
But
four superintendents, four this and that,
exactly,
right?
but not a serious plan to do it.
So, and I don't think that I, have
Right.
thought enough to give you that either, but, what about starting with taking the regional assets that you already have, right? I mean, people in my town don't know it, but Cheshire belongs to probably 100 different regional associations, right? We're all part of dozens of different regional endeavors, whether it's the way that we get our water, the way that we collect our trash, the way that we prepare for emergencies. What about a concerted effort at the state level to start standardizing the regional cooperative efforts that exist today? I mean, it's dizzying the number of regional efforts that we have, and even at the state level, when the state is just organizing its responses to things, it changes the regions all the time, whether it be emergency management districts or DEMIS districts or DCF districts, right? The state itself uses different regions for every agency. And of course, counties are already an anachronism. You can't go back to counties. What if the state just said, okay, for state purposes, we're gonna ask every agency to use the same regional groupings. And we're gonna start providing incentives for existing regional cooperative efforts to adopt those regions. What if you started doing, what if you began there? That wouldn't be controversial, because it wouldn't be making anything new done on a regional basis, but it would at least start people getting comfortable with a actual definable set of regions in the state.
A topic that's come up a lot in some of our local towns is the potential dangers of these chrome rubber synthetic fields. What are your thoughts on a potential federal study into the dangers of those?
Well, I've, Senator Blumenthal has, clearly taken the lead on that, and I've been very supportive of his efforts. Much of this is funded with, state dollars, some with federal dollars, and, we need to have a definitive federal study to understand the potential dangers that are posed. I've done some work in this space, so I've been leading the work around PCBs in our schools. So we have the synthetic rubber on our fields, but we still have very old PCBs sitting in mechanical units in a lot of our old schools, I'm very supportive of a federal study on synthetic rubber, but I also think the federal government's got to get a lot more serious about giving guidance to schools on the removal of PCBs.
On national security, what do you think are our biggest challenges in the wake of Paris and Brussels? Are we, in your opinions, are we sharing enough intelligence, or where do you think we need to go in the lessons learned there?
Well, I think I'd identified 2 challenges that weigh on me, and I do spend a lot of time working on this in the Foreign Relations Committee. The first challenge is information sharing. So our ability to prevent a European-style attack on U.S. soil is only as strong as the no-fly list. Europeans can travel to the United States through the visa waiver program with almost no security screen. What stops terrorists or potential terrorists from coming to the United States is the no-fly list. European countries are required to give access to the United States of all of their anti-terrorism investigations so that we can take someone that they're investigating and put them on the no-fly list. Much of the details surrounding the compliance with that requirement are classified, but I can safely tell you there are many European countries that are not complying, that are not giving us information about their pending investigations, leaving the US vulnerable to one of these plotters traveling to the United States and attacking us. So I've said that the United States should look into suspending visa waiver program eligibility for countries that aren't sharing that information with the United States. I think that's critical. Second, Europe has to learn from their mistakes. Europe does not have the capability to track these terrorists across state lines. Imagine the United States trying to fight domestic terrorism without the FBI. That's essentially what Europe's doing. Europe's got a whole bunch of local police departments. None of them are required to talk to each other. And they're trying to track a terrorist organization that knows no boundaries. Europe needs an FBI. Now, they've got something called Europol, which is tiny, which is the size of the New Haven Police Department for the entire continent. So they need an FBI, and they need to give up some of their sovereign law enforcement capabilities to this continental law enforcement agency. The second challenge, and I'll just talk about quickly, is the rhetoric in this presidential campaign is frightening. How badly these Republican candidates misunderstand terrorism is stunning. The idea that you would use nuclear bombs or carpet bombing to confront a tactic totally misidentifies the nature of the threat. And I'm truly scared that if any of these Republicans becomes the president, that they are going to take the fight to ISIS in a way that triples their numbers. You read the founding documents and principles of ISIS, and you don't have to go too deep to figure out that they are desperate for American troops on the ground inside the Middle East. And if you listen to Ted Cruz and Donald Trump, that's what they sound like they're about to give them. So, people are frustrated with the pace of Obama's efforts, but we're trying to learn from our mistakes of the past. The quick hits in Iraq and Afghanistan didn't work. Shock and awe made us feel really good, but it created a domestic insurgency that we're still dealing with today. The way you beat ISIS is to be comprehensive and methodical, and let the lead be local armies and local countries on the ground who have a long-term stake in stability. So I think the rhetoric around this presidential campaign is really, really frightening.
What do we do about, I just read a young lady from, I think, Virginia, the latest American who was going to join ISIS. Seems that a lot of homegrown, a lot of young Americans are picking up on their message. How do we stop that?
Well, I don't think I don't think it's true that a lot of America, right? I mean, I think if you compare ISIS recruitment in the United States to ISIS recruitment in Europe, there's no comparison.
Right.
There are Americans that are being swept up in this radical ideology, but the numbers per capita are much smaller here than in almost any other part of the world. And I would argue that's because of America's history of inclusion. Muslim populations have integrated into the United States, much like every other immigrant population. They've been able to retain a part of their own heritage while also adopting something that's uniquely American. And ISIS recruiters, frankly, find it hard to recruit in the United States because there is not this antipathy for the state that exists in American from immigrant Muslim populations that as exists in a place like Belgium or a place like Paris. And again, that's why this rhetoric in the presidential campaign is so scary. Because the minute you start running police patrols in Muslim neighborhoods, the minute you start shutting down this country, to Muslim immigrants is also the moment at which that radical ideology starts to find purchase in Muslim neighborhoods in the United States. So, that's not an answer to your question. The answer to your question is we double down on inclusion and we resist these temptations at exclusion. We continue to invest in surveillance programs, right? I mean, I've never supported the surveillance of innocent Americans, but if you're tapping the phones of the right people, you'll find their communications with would-be recruits. So, we all came together and supported the new version of the Patriot Act because we believe that the United States needs to, ratchet up surveillance of the bad guys. So you continue to invest in those programs, and you continue to invest in inclusionary politics.
Given the tenor of the Republican campaign, I know you're not going to take anything for granted, but do you have a good feeling about the Democrats' chances given the chaos on the Republican side?
I do. I ultimately, if you sort of accept that the Republican nominee is going to be either Donald Trump or Ted Cruz, I don't think either of them are palatable to the middle of the American electorate. And for all the attention on Donald Trump, Ted Cruz and his radical ideology has largely gone uncovered. But I don't think if Ted Cruz is the nominee that people are going to forget his work to shut down the federal government, his irresponsible talk about how you defeat terrorism, his dangerous policies for women's reproductive health care. So yeah, I think we can take anything for granted, and I think Hillary Clinton's going to have to work incredibly hard to win votes this November. But I feel pretty good about it. But I'll say this about this election. This election should be a reminder that people in this country are in a revolutionary mood. And I mean this in this sense. They are pissed off, and for good reason. They have seen this economic recovery accrue to the benefit of everybody but themselves. They see all the people who were responsible for the economic nightmare of 2009, 2010, right back in their penthouses. And their wages haven't moved, their retirement accounts haven't moved, their healthcare benefits have moved, but only downward. I mean, we all need to learn a lesson from this election, and it's that incremental fixes don't work for people anymore. People mock Bernie when he talks about free college because it's unrealistic. Well, for a lot of people, the only thing that's truly unrealistic is the status quo. And they are very attracted to big revolutionary ideas right now because small incremental ideas don't provide any solutions for them. And so, there are important lessons to take from this election, and big ideas are in.
So are you supporting Bernie or Hillary?
No, I think there's a middle ground here, right? I think you need a president who can actually get things done, who still is willing to propose big change. And I think, my support for Hillary is because I actually think she's going to be able to get major changes done for this country. I'm not convinced that Bernie would be able to do that. I also, do think this country is under grave threat right now, and I want a leader who's ready to protect us internationally on day one. And for me, Hillary's clearly that choice.
Other than yourself?
We have time for one more
Okay.
question.
Are you worried about the investigation into emails? No.
No, I think this is.
It pops up every once in a while that this is, it's advancing. If the candidate got indicted, then that would be a huge.
Hillary Clinton's not going to get indicted. There's no chance of that. And whatever the FBI has to say about this, they should say it sooner rather than later. But this is a This is a dispute between agencies, not a criminal investigation of a presidential candidate.
So other than you, who's Hillary's best running mate?
I would say keep me off of any of those lists. So, yeah, I don't know. I mean,
Do you have somebody that you think?
no, I don't have any. I don't have.
Off the
any,
record,
I don't
you
have
have
any favorites. So, I mean, there's a couple of my colleagues who get mentioned. No, I mean, I'll say this on the record. I mean, there's a couple of my colleagues who get mentioned frequently. Both Cory Booker and Tim Kaine are amongst my closer friends in the Senate, and I think either of them would be a great choice. I think the question of who your vice presidential candidate is largely a parlor game that has very little implications for the general election, except if you make a horrible mistake, right? And we had one example of that. And I do think the choice of Palin did move votes in the fall, but I think as long as you don't make a big mistake, your vice presidential pick, doesn't have much to do with how you ultimately do in the fall. So, speaking of that, I need to go do an event